Right. It's just one thing, you know, that I see. My colleague is also here with it, and
Okay.
How are you today? Can you hear me?
That's great. So let's start off without any further delay. We're going to be looking at, this particular unit, which is Unit 4, Working in Health and Social Care. Now, some of you in the past have essentially, worked within this sector and can clearly understand the requirements essentially for, the basic requirements that you need to be able to fulfill to be able to work in this particular sector. Now, one of the key bits that we look at with regards to, looking at understanding, let's say, working within this sector is that all of us need to have certain skills. And these skills are primarily related, to be able to provide care to patients. So when I look at skills required for working within health and social care sector, can you think of some of the qualities or, let's say attributes you have, which are a bare minimum? They get asked while you do an interview, and before you start working within this sector as a healthcare worker or as a healthcare assistant or somebody as a healthcare professional. Can you recall some of the skills that you need to be able to work, as a healthcare assistant or as a healthcare professional in this sector? Anybody, there are no right and wrong answers. So anybody, in terms of, what could be the skills that you think are required when you typically work within this sector? Any idea? So when we look at talking about skills, I'm talking about skills like sometimes I say I'm a team player. Sometimes you say I have strong or good communication skills. You say I have a skill of time management, or, I have good work ethics. I'm patient, in terms of working with individuals or working with people or working with children in general. I can work within teams. These are the skills that we typically talk about when we talk about, people who work within the health and social care sector. Apart from this, there could be lots of different types of skills that we could have. And these skills, would be useful for us in terms of delivering our job or completing our job responsibilities on a day-to-day basis. So some of these skills could also include that you're compassionate about, speaking to patients or speaking to people and relatives of patient if they are, having problems. And these skills can be divided into what are called soft skills and hard skills. So soft skills are skills which are personal attributes. That means they enable you to interact effectively, work harmoniously in a particular place with a number of people. And these soft skills typically are skills that are because they have been gained, when I say soft skills, what I mean by that is they have been gained primarily, these are non-technical skills, and these are skills that you have gained over a point in time, primarily because of your character, your personality, your trait, your interpersonal skills, or ways through which you interact with people personally. Now, when we talk about soft skills, there are lots of different types of soft skills which are used within the health and social care sector. And these skills can be, skills like you have the ability to focus, you work, you can be quite friendly to approach, you're able to manage your work, your time, you're confident, you're able to show empathy, you bring enthusiasm and positivity towards your work, and things and skills which could be used or applied under common sense. So sometimes we use skills when we think of a situation and we think, okay, this is the way I think it should be done, and that is using common sense skills. Now, soft skills are non-technical skills essentially, and they are required for you to work and interact with others, and that is where these skills are important. Now, when we talk about hard skills, these are skills which are gained through training, through academic qualification, or through work experience of working in a particular place. Now, when you decide to work within the health and social care sector, you are expected to have a combination of hard and soft skills, and these skills are very important for you to be able to work effectively within the health and social care sector. And when we talk about hard skills, we are talking about skills which could be, you can speak 2 languages, or you are a bilingualist, you have skills in accounting, or you have skills because that you've taken in a health and social care qualification. So and you have a diploma in place, which allows you to understand how to work within this sector. You have programming skills. When I talk about in general, people who work within IT, and if they say I'm a programmer, they have a programming skill. They've learned a programming language, and those are the kind of skills that you would need, which are basically skills that you acquire after training, academic qualification, or study in those cases, and they are objective and quantifiable skills that you've gained, and you have a document or a proof to show that I've done this course, I've done this qualification, and that makes it easier for you to do your job in a particular place. Now, when we look at studying this particular unit, we are looking at primarily studying this unit from a point of view of understanding what are the key requirements in terms of working within this sector. And when we talk about this from the aspect of looking at how do you work, and what kind of skills you would need to have while working within this sector, would be to ensure that we study this particular unit and understand some of the key aspects of things which are required for you to be able to understand and deliver services or work as a healthcare professional within any sort of a setup, whether it's a care home, old age home, nursing home, it could be a hospital, a surgery, a community center, or a healthcare facility, which basically is, dealing with patients or dealing with clients essentially who are coming in to receive some sort of treatment. Now, there are bits and pieces that you need to understand in terms of person-centered approach. You also need to look at understanding safeguarding. You need to understand communication and barriers to communication. We need to look at data protection. We need to look at certain legislations which are required for you to follow and also implement while you are delivering or fulfilling some of your roles and responsibilities within this sector. Now, we've all gone through COVID as a pandemic, and what we've seen is that the importance of PPE, personal and protective equipment, which was important in obviously reducing the spread of infections, specifically with healthcare workers who were working during the pandemic tirelessly to provide services, take care of patients within the ICU or within hospitals, or people who were admitted because of the because of catching the virus and had severe symptoms and were requiring essentially let's say supervision. So we will discuss a lot of these things in the course of this particular unit, which will be making you aware of the fundamental principles which are required to be understood when you work within this sector as a health and social care worker. So things like some of the key bits of theoretical bits that we will understand. One would be person-centered approach. Second would be the 6 C's of care, which are termed as 6 C's of care, and they are bits and pieces that we will understand why they are important when you work within let's say, let me not put it this way, you work as a healthcare worker within this sector. So let's start off with getting into the first assessment criteria and the first learning outcome, and we would look at what is a person-centered approach. Now, one of the key things that we want to understand is that when we discuss person-centered approach, we are looking at understanding what are the requirements of you having to work, and basic requirements of you having to be able to offer services within the sector. Now, what we mean by person-centered approach is that every person which is receiving care needs to receive care in a focused way which is going to be very bespoke and tailored to that particular patient or that person being treated. And in this case, the focus of the care being provided is the condition and the ability of the person to be able to take in the care. So when we look at the approach, which is defined as PCA or person-centered approach, we are focused on the person, what can they do, cannot do, and in what conditions they will be able to provide this care so that the person receiving it is able to get back on their feet. Now, person-centered approach, as the word itself or the phrase itself says, is focused on providing care, meeting the needs of the person who's receiving this service or the care. So, for example, if somebody has undergone an operation, and if they've undergone an operation and they are now, let's say, recovering from the operative procedure, the healthcare worker or the assistant who's going to work with the person would be to look at ensuring they are able to get proper medication, they are able to get support to dress up, or, for example, do daily chores that they need to be able to perform, get a balanced diet or a meal. And these basic requirements will need to be focused on ensuring that the person receiving this care is actually benefiting from it. And that is the whole concept of person-centered care. So in this case, what we look at is that the person receiving the care would take, and person providing the care would take into account the needs of the individual, ensuring that person receiving the care, their preferences, their needs, their values, their beliefs, their culture is taken into account and is respected while providing this service to the patient under the person-centered approach. Now, what you see on the slide, which I put across here, is a bit of a conversation which is happening between the nurse and a patient, and the nurse is making or asking questions which is making the patient comfortable in terms of disclosing the information about why she is coming to see her and what kind of problem is she facing, and what and how would the GP, or in this case the nurse, would go about diagnosing the problem and giving a suitable solution which is acceptable to the patient in order to overcome that particular condition. So person-centered approach, as we talk about, is basically a combination of a couple of things. It talks about personalization. It talks about building a relationship between the patient and the person who's providing this care. And this approach of personalization, or putting people first, was something which was put forward by the government under the white paper called Putting People First in 2007. And this later on was then incorporated into the National Health Service as the basic philosophy that any treatment, any, say, for example, a service being provided to people who are receiving care would be done under the concept of what is called person-centered care, which means nothing but personalized care, or care which is focused on meeting the needs of the individual. Is that clear? Is that understood? So what is person-centered care? Care being provided meeting the needs of the person who's receiving the care, and it is focused on ensuring that the care is tailored to take into account the preferences, the aspirations, and also the beliefs and culture of the person receiving the care. And this was something which was outlined in the paper, in the white paper, which was put forward to the government in 2007, called Putting People First. And then this as an approach was incorporated into the National Health Service. Now, when we talk about person-centered approach and we talk about what all does it encompass, because one size doesn't fit all. So, I can't, for example, if you have a fever, a simple situation, if we analyze using an example, is that if you are a person who's having fever, or if you're running fever, now this fever could be because of many different symptoms, and it could be of many different types. So we can't, when you go to your GP, the GP cannot prescribe you a standard medicine just by saying that, okay, if you have fever, take this, take the Piriton. So if you have fever, take Cocodamol. No, the person who's running fever, if you go into the GP surgery, the GP, or you meet your GP, and if that fever is not going away for a couple of days, the GP is going to do a proper investigation, or the nurse that you meet up is going to do a proper investigation, and that investigation will revolve around asking a lot of questions. And they could be things like, okay, when did the fever start? What are the symptoms of you having the fever? Are you having any other difficulties apart from having a headache or maybe a stomach ache? Or what are the symptoms which this particular fever is showing? They would also ask you questions related to, is there anybody else in the family running fever? Did you have any of your colleagues at your place of work showing the similar symptoms? So the idea here would be, the questioning is based around recognizing the symptoms and to create a bit of a record or a case history in terms of why this condition has arisen, and what are the reasons or circumstances behind which this fever has caught on with you. And after looking at if the diagnosis is, or through the question answering session, if the diagnosis is not conclusive, the doctor or the GP or the nurse, whichever you're seeing, GP or the nurse would essentially then recommend you to get blood tests done. And that would essentially also provide additional information in terms of why are the reasons that you are having this fever and it is not going away. Now, sometimes it could be a simple case of you are under the weather, and you're running a fever for a day or two, and the GP would say, okay, this is a normal case during summers, or when we have high pollen count in the air. Typically, a lot of people get a running nose or maybe get some sort of a fever. And in those cases, the doctor would prescribe peritones, because they would have done some tests and found out that you're allergic to pollen. And in this case, the condition is very well established. You've had this in the past. He can look at it from the records. And in this case, the doctor would then maybe do some additional tests. But if you come back again with the same symptoms, they might do a similar set of tests and then prescribe you peritones to say, okay, this is hay fever because you're allergic to pollen, and this would be looking at prescribing you taking peritones. So this approach of the doctor looking at different symptoms and ensuring that you are prescribed or given medication which is meeting your requirements and helping you get better is a personalized approach which is taken. And this cannot be applied to anybody who's coming in and has fever or running nose or chesty cough, and the same treatment can be given to that patient. So this personalization and looking at ensuring that you get the care that is required for you to get rid of that particular allergy or that particular condition will be focused and specific to you as a patient, as a person. And this particular approach is going to be called person-centered approach. Now, let's go a bit deeper into understanding what is person-centered approach, and what when we talk about these person-centered approach and its values, there are these 8 values that we talk about of person-centered approach that everyone has to observe when we say that we are providing person-centered care and support to a patient. Now, these 8 values essentially are values related to independence, which is the first value that we talk about. And if we talk about, one second. So when we talk about these 8 values of person-centered approach, there is a handout which I'm going to also share with you. And this particular handout that I want to share with you is something that you will need to fill in to complete, your first part of the task, which is talking about, person-centered values and how do you put that in practice, and do you have these values or not. So I'll show you a handout towards the end of this session, and that is something which I will share with you so that you are able to complete and fill that handout to understand what are these person-centered values. Now, there are 8 values, but these values have been added over the years, and they have sometimes when we talk about these values, there could be 6, 8 or 10 of them that we refer to. And when we talk about these person-centered values or the approach that we take in providing care to the patient, we have to basically look at in the approach these 8 values or 8 principles being adhered to, or when we teach, say, for example, when we, in this case, deliver this particular care to the patient. So when we look at the first such principle, we talk about, respecting the individuality, independence. I'm just going to briefly show them to you on the slide first. Then we'll discuss them. Partnership, choice. We look at dignity. We look at respect. We look at respecting their rights. And these are the 8 principles that we're going to talk about, which are related to what is called the person-centered approach. And when we implement this approach, these are the 8 values that you will bring into practice while delivering care to the patient. So let's start with the first one in no particular order. Let's start with respect. Now, the first value that we talk about in terms of person-centered approach is the value which is respect. That means you will be looking at respecting the individual, and this respect that you provide to the individual receiving care is being provided irrespective of their background, caste, culture, gender, and their beliefs that they have with regards to when they are receiving the treatment. Now, when you work with other people in providing this particular care, you are also making sure that you're not ignoring their values and beliefs that they have, and you incorporate them in terms of providing the care which is tailored to meet their requirements. So one such example is when we talk about the use of the term endearment, we say calling somebody as an individual, calling somebody hello love or hello dear without asking their name would, you would be looking at using some of these, terms. So when we talk about usage of these particular terms, you are looking at, talking to them as not saying hello, hi. This could be one way, but obviously sometimes when we look at healthcare workers and, professionals addressing their parents, they say, hello, love, how are you? And, say, hello, dear, how are you feeling today? And this particular affection that you show is a way of showing respect to that individual, which is important when we look at practicing person-centered approach. So you would get to hear these words typically when you have somebody speaking to you with affection, giving you respect, and they are going to be related to, one of the aspects of person-centered approach, which means that you're looking at, even without knowing the name of the individual, you're actually giving them respect by calling them hello, love, how are you? Or hello, dear, oh, what have we got here today? And sentences like these would basically show the aspect of affection and respect that you're doling out towards them when you're speaking to them or you're giving them due attention. Now, sometimes some people dislike this endearment, which is the aspect of showing an affection to an individual without having to know them in a bit more detail, like their name or where they come from and things like that. So in this case, sometimes you have to look at finding out what is your name or how do I address you and what do I call you, and you are going to be looking at working out ways which are going to be acceptable with the patient while you are interacting with them. And that could be the use of affectionate words like love or dear, or in some cases by addressing them only by their first name. And that would be the aspect of using one of the principles, which is respect. Now, the second thing that we will look at in terms of, the second principle, I would put it this way, that we will look at enduring would be dignity. Now, sometimes if I look at the meaning of the word dignity, I don't know in terms of when you talk about dignity in terms of the word, you're basically looking at being, fair. You're honoring and also respecting the individual, but in a serious manner. And that would be, dignity, typically, offering dignity in, dealing with the people when you're dealing with essentially people within, the health and social care sector. So here, when we talk about dignity, dignity is basically showing care, and that means providing the care that supports the self-respect of the individual or the person, recognizing their capabilities and their ambitions, and also you're not looking at undermining any of their abilities or character traits. And that is where you're looking at considering dignity. Now, this is considered important because this is aimed primarily at somebody who's providing care and people who work within this sector. So all people like managers, staff, employees, partners, third-party suppliers or, contractors will all need to ensure that they understand what is dignity and dignity in the context of, health and social care. And when we talk about how dignity can be shown, what we are looking at is we are treating them equally and providing them the support that they need in order for them to be, autonomous. That means independent. And this is something which will be respecting their dignity. A simple example that I will give you here would be that when you look at providing care to the elderly, sometimes you see that they are quite, they basically demand a bit of dignity. So, for example, if they're dressing up, what you will generally see is that the nurse will pull the curtains around the ward or around their bed to ensure privacy as well as dignity when somebody's changing clothes or obviously looking at getting treatment. If you're looking at getting say for example, if a GP or a consultant has come around and making the round or doing the rounds in the ward, and they are looking at the patient and looking at dressing the wound or probably inspecting how the stitches are coming up. If you've had a clinical procedure, then you would generally see the nurse or the healthcare worker essentially doing the curtains or drawing the curtains around the patient's bed. And that is primarily done as a gesture of dignity, which is to preserve the individual's individuality, and also addressing that, yes, they would need some privacy in order for them to receive that, diagnosis or that treatment. Any questions at any stage, please feel free to ask me. Now, the third principle that we will talk about in the person-centered approach is going to be around individuality. So when I talk about individuality in particular, just the literal meaning of the word individuality, what we are looking at is basically talking about the character or the quality or the, of a particular person which distinguishes them from the other. And in this case, when I talk about the, meaning of individuality in the context of, health and social care, what we are looking at is, talking about how would the care be identified for a particular person. So in the case of an individual, if I'm an individual and I'm, as I gave you an example earlier of that, okay, I am an individual and I come from a certain background, my culture, my beliefs are, going to be unique. So in this case, each person we treat when we are looking at providing care within the health and social care sector, within the National Health Service, within a care home or any sort of a setup, we are going to make sure that every person is given treatment on the basis of, or given due credence on the basis of their own identity, their needs, their wishes, their choices, and their beliefs and values, and in general, the culture. So this approach of one size doesn't fit all actually works here. So you're looking at providing personalized and person-centered care, which is meeting the requirements of the individual. And that is where we refer to what is called person's individuality. That means we're looking at their individual needs, their preferences, and allow them and give them all the information for them to be able to make an informed decision whether to go ahead or not go ahead, or get the treatment or not get the treatment. And simple example that I would give you here is, if you are undergoing, say, a major operation and you've been diagnosed with a particular, say, symptom or a particular disease. Now, if you have to undergo an operation to get rid of that condition, then you would have an appointment with a clinical nurse, a consultant, and the team which is going to be operating on it before even the operation takes place. And they would give you all the information. They would take into account your preferences, your needs, and your reasons of why you're undergoing that particular operation. And they will then incorporate and adjust to as much as possible to ensuring that they're able to preserve your dignity and your individuality, and then still give you the treatment on care required for you to get better. And individuality, privacy, respect, and dignity are important cogs when we talk about person-centered approach. Another example that I would give you in terms of individuality, when we talk about nurses in particular, say, and this form of when we talk about individuality in the context of nursing, could be that you have people who are going to be self-autonomous, they're going to be, self-reliant, and they are going to be having their own personal choices or rights, and they would expect that you would provide them care, which is going to be predominantly related to taking into account their beliefs, their rights, their individuality, their personality, and still give them, the personalized care which is required by taking into account their beliefs, their preferences, culture, background, and what they believe in. And that would be one of the important principles that we talk about in person-centered approach as being individuality. Now, the next one that I would want to focus on is choice. Now, sometimes you look at, if you're undergoing, say, for example, if you have a problem and you're undergoing, say, some sort of, let's say, a phase in which your disease, or for example, the symptoms that you have are not recovering and not helping you recover, then in some cases, what you will generally see is that the doctors and the nurses in some cases would be offering you what is called a choice. And when we talk about choice, they are going to offer you choices which you're going to make, but the choice is going to be centered around providing you information, providing you all the information which is required for you to be able to make an informed decision. They will tell you maybe the benefits, advantages, and disadvantages of undergoing that procedure, and they will then leave it with you to look at making a choice whether you want to go ahead or whether you don't want to go ahead with that particular operation or that procedure. Now, when we talk about this as an option in terms of choice, we are looking at referring to predominantly the aspect of how an individual will be supported in making that choice about what kind of care and support they receive. Now, the information that you're given is solely going to be based on the process that is going to be enacted or will go through, and you will then be able to, using that information, make an informed choice and decide whether you want to go ahead or you don't want to go ahead with it. And this aspect of giving information without putting pressure or expecting an immediate decision from the individual is going to be considered under what is called choice. And this is also one of the important principles of, person-centered approach. So when we look at providing a care plan for somebody who's, say, for example, if somebody's undergone angioplasty, or somebody's undergone, in a heart operation, and after the heart operation, they are going to undergo an heart operation, they will be given choice by the consultant to look at different forms of treatment first. So if you have high cholesterol in your blood and that is leading to some sort of complexities, then at some stage your GP will ask you to consult a consultant. The consultant, after looking at all your reports, the blood test, the ECG, electrocardiogram, and they would then recommend a further few tests. And the reports of those results, of the test results, would then be explained to you by the consultant in terms of choices that you have to undergo a particular treatment. So in some cases, they would say we could control your high blood cholesterol by using medication, by using, say, for example, exercises, or looking at you being put into a weight loss program. You looking at making lifestyle choices in terms of changing the way you eat food and the number of calories that you intake or the type of food that you eat. And they could be one such option. The second option they would recommend would be to undergo surgery. And the third option could be they recommend you to undergo surgery, but maybe a surgery like an open heart operation rather than an angioplasty wherein they put in a stent. Now, all these options would be given to you, and the benefits, advantages, disadvantages of this will be explained to you by the consultant surgeon or by the doctor. And then with this information leaflet and all the details being provided, reports of the results, test results, you would then be expected to make a choice in terms of how you would want to go about it. And that decision of that important decision, which will be given, which will be left to you to take, would be the option that you would make under by reading that information, going through it, consulting with your family and your near dear ones, and then making a choice that this is the course of treatment I would follow. And that is the principle of choice when it is applied, when we talk about person-centered approach, one of the key principles. The next one that I'm going to talk about is rights. Now, sometimes you get to hear that individuals have right. I have my own rights, and I can decide or opt out or opt in to say that I would undertake this treatment or not undertake this treatment, and they would be generally considered under what are called individual rights. So when we talk about one of the principles that we look at predominantly under the aspect of rights, here is what I would suggest that we talk about what is called the Human Rights Act of 1998. Now, in this case, this was a legislation passed by the government, and this basically sets out what are the rights of people in the UK. So when you receive medical treatment, when you receive care from the National Health Service, you have the right to be able to speak your mind, and you can be kept safe from harm as long as you understand what are your rights, how you respect them, how do you adhere with them, and how do you follow them. Now, should the conditions be such that they have been explained to you, then at the end of the day, it is down to the individual to make that decision. And once that decision is made, it is the individual's right. And as your right, they have to be respected by people within the community. That means in the health and social care ecosystem. So maybe your GP, your nurse, your consultant surgeon, and whatever decision you have taken, they have to respect that, because under the Human Rights Act of 1998, this is the main legislation that sets out what are the rights of people in the UK when they are receiving or they are receiving information or receiving any sort of any sort of, say, for example, treatment. Now, when I talk about in general rights, it is my right. How do I dress, or what do I eat, or where do I go? This is my basic right. And then, I can choose to friend anybody. I can choose to, speak to someone, and this is my individual right. So as long as you're aware of your rights and responsibilities, sometimes you would see that in medical procedures, in treatments which are done, you are asked, your near dear ones or your relatives, our immediate relatives are asked to sign a declaration. And that is a declaration to say that in the eventuality of something going wrong, or if an error occurring, this can lead to loss of life. But the medical team will not be held responsible, because they have already explained to you the complications which can arise when you undergo a clinical procedure, or in some cases, given you all the information required for you to make an informed decision. And in those cases, they have their rights and you have your rights. So rights is one of the key bits that we have to take into account when we talk about person-centered approach. Now, the next one that we talk about is independence. Now, when we talk about independence, what we are talking about is promoting individuals' independence, which means that we are to look into what they can do for themselves, and we are going to try and empower them to do as much as possible for themselves. Now, it does not mean that you're going to leave them to cope with it or do things on their own. An example that I would give here is when you look at elderly couple, sometimes you would see that care workers go in and stay at home and help out in the daily chores which people do, and they, because of their old age, they can't do these daily chores. So sometimes you would see that people, they like they want their independence to be respected. They do not want you to infringe on certain areas which they can do themselves. Say, for example, a case in point is that sometimes you see that people can make a cup of tea in the morning, and even if they are in a care room, but maybe sometimes you would see the nurse would come in and say, no, you should have not made tea. This is a hot kettle. You are not able to do this. And that would mean that you are hindering the independence of the person who can do or carry out some of the daily chores on their own on a daily basis. So in those cases, what we need to make sure is that we are respecting the independence of the individual to be able to do some of the things on their own. And we need to be supportive in terms of one, acknowledging that they can do these things independently, and the second is if they need any support or if they have any requirements for any support, then we should be able to provide that to them and make them feel as independent as possible when they carry out some of these day-to-day tasks. And that would be respecting the individual of the person under the person-centered approach principle. Last but not the least, we talk about partnership. Now, when we talk about partnership, we are looking at working in partnership with professionals, because when we talk about, we giving care or we providing care, sometimes you would see that you are not the only person involved in delivery of that care. There could be a number of your colleagues which are responsible, and are working very closely with you to be able to deliver care for that particular patient. So you are working in partnership essentially when you are working towards providing individual care to, say, for example, or care to some sort of a patient. And in this case, sometimes you work along with their family. Sometimes you share things with their family. You request for information from their family, which will help you understand and deliver maybe a more personalized care to the person. And in this case, it is important that when you work within this sector, you're able to build the aspect of relationships, which allows you to depend on other individuals to be able to deliver care to patients in their time of need. And that could be in the form of partnerships, which could be a number of colleagues that are working with you to be able to deliver care, their family members. When I say there, I mean patients' family members, and also looking at you being able to develop trust, values, respecting their values, and ensuring that you are able to communicate in a way wherein it is making a connect with the other individual or with the family members of the individual. And appropriate this procedure of communication allows you to send across appropriate information, which is in the best interest of the individual receiving the care. So partnerships are important. Sometimes you see when you look at you look at your kids and they are studying, for example, and they are in a particular class and they are studying along with 30 other children in the class. Your kid would be looking at having some friends, some close friends, and some very close friends. And this shows you the pattern of how your child is able to develop a closer relationship with a particular person, and that allows them to feel comfortable, a bit more relaxed, and allows them to be more open and more in around their own kind of people, which allows them to thrive and, say, for example, understand things in the class. So similar concept is also applied when we look at the person-centered approach. And here you're looking at working in partnership with the individual and the families and family members of the individual to be able to provide a plan for care which works for them. And this plan, care plan, is then supported by some of your colleagues, some of your, when I say some of your colleagues, and also by family members of that person. So if you were diagnosed with COVID, just as an example, and you were admitted and now you're recovering from COVID, you would have different sets of people which will be working with you to help you get well soon. And there could be a team of people from the hospital, nurses or healthcare assistant or workers who normally regularly visit you to keep a check on your recovery. You could be working with some sort of therapist or a physiotherapist, essentially, who's helping you with breathing exercises, because people diagnosed with COVID and who are recovering can sometimes feel short of breath. So they are going to be working with you to help you build your stamina, do some physical activity, and ensure that you're able to, regain back your stamina, which was before you had COVID. And then your family members will be supporting you throughout in terms of your recovery by, providing you care and support in the way that you would want it to be delivered. And that would be looking at the process of partnership. Now, in today's session, what I would want to do is primarily just cover this particular aspect of person-centered approach. And what I would also like to share with you is a document that I would suggest all of you fill. And this particular document is what is called the person-centered approach. And what does it mean to you? So here I've written down the things that we've discussed. And what I would expect you to do is, when I email this across to you, is to fill this document up. It's a Word document. You'll be able to press enter, and whatever you're writing can be expanded. So the idea here would be to define what are person-centered values and what is their context or their meaning to you in particular. How would you, essentially see these values relating to you in particular would be the, the purpose of this particular exercise. So here you could give by writing the definition and also maybe taking up an example to explain what does this mean to you in terms of the person-centered value. So this is a task that I would suggest you would need to complete for tomorrow. A couple of words, about 20 to 30 words in each of the rows would be good enough to cover and make us, understand this particular concept of person-centered approach and person-centered values, which are basically nothing but guiding principles that help us put the interest of the individuals receiving care or support at the center of everything that we do. And as healthcare workers, these would be things like individuality, independence, privacy, partnership, choice, dignity, respect, and rights. And that is what needs to be discussed when we talk about, this particular task that you need to complete. So with this, I would like to stop today's session, and we'll meet up tomorrow on time at 11. Apologies for today, but we'll be looking at starting on time tomorrow, and then we'll be looking at covering the balance part of the assessment criteria and learning outcome 1. Now, any questions on this so far? Any questions from anybody on this so far? All right. Now, there is on Moodle, you'll be able to find this Word document. You'll be able to also find the presentation that I've shown today, which will be available on Moodle for you to be able to access. And we are going to be progressing on our discussions for the balance of the assessment criteria and learning outcome 1 from 1.2 tomorrow. So until then, take care. Thanks for listening in and joining today, and I will see you tomorrow.
Thank you very much. Have a good day.
Thank you. Bye.